Hey everyone, you can see I have a guest.
Hello.
This is Dr. Prem Tripathi. He is a facial plastic surgeon in the Bay Area and one of my favorite doctors to follow on social media. I found you on TikTok.
Yes, you did.
Today, we're going to answer your rhinoplasty questions, which we get a lot of questions about.
All the time.
All the time.
Yep.
I'm sure you're just like constantly hit up for...
Yeah, I can't answer them.
Anyway, we both have had nose jobs. He's had 2 nose jobs.
2 nose jobs.
So we're going to answer all the questions today.
Let's go.
Don't mind me. I printed this. Actually, Anna printed this because we got all these questions off of Instagram.
Yeah.
Tell me a little bit about what you just think people should know about rhinoplasty and nose job.
It's not the same as just like going and buying a car, right? So you get a nose job and you can go to one surgeon, they have a certain set of techniques. You go to another surgeon, they have a different set of techniques. So, it's not a one-stop shop, but it is not like getting the same product at a different place. It is different products, different places. You got to find the right surgeon.
All right, we're going to go with the first question.
Let's go.
What are your thoughts on liquid rhinoplasties? And if you guys don't know, this is when you use filler for the nose.
I know you've had it, right?
I have. That's actually what led me down the road of getting my own nose job, finally.
I think it's nice because it does give you an idea. It's sort of like a test drive. It gives you an idea of what it can look like.
Yeah.
The challenge is, though, it's a very tricky place to put filler. There's complications, one of which is blindness, although,
that's all?
Yeah, theoretically, it's a risk with any filler. So I say if you're really interested in it, go to someone who does this day in and day out. But I just, it can really only make your nose bigger for the most part.
Right.
Dr. Rivkin, he's the one that sort of pioneered it. He does talk about making the nose look a little bit smaller. It can make it look more uniform. I'm just not a huge fan of it. I can't make anyone go blind with a rhinoplasty, to be honest.
Like a real
with like a surgery. And I'm not going to put filler in a place that's that risky.
So you don't do it?
I don't.
You know what? I love hearing that you're like a hard no.
Yeah, I think it seems risk-free because it can be done in the office. There's no downtime.
Right.
A little bruising.
You can reverse it.
Yeah, and get rid of it. But I've taken filler out of people's noses during rhinoplasties because it's just accumulated over time too and does sometimes create some scar tissue.
I had a doctor make me look a little Spock-like. That's when it started leading me down the road of
really?
I was kind of like, maybe I should get a nose job. I still did it for years. It was my dermatologist who was like, I refuse. You've done this enough times.
No kidding.
That you need to just go see a surgeon.
So it started to look like it was way up here?
Yeah.
Yeah, that's what
exactly.
Yeah.
Because I think people don't consider this, that if you're using filler, you are adding to your nose.
Yeah.
And so eventually it is going to start to...
It's going to be bigger.
Yeah. And I didn't want a bigger nose.
Yeah.
Is there any way to achieve the perfect nose without surgery, which I think kind of means filler?
There's no perfect nose, right? Like, let's be very clear. There is no perfect nose.
No, of course not.
People,
Though I think mine came out pretty good.
Yours is good, I will tell you. It's got to fit your face.
Yep.
It's got to not detract from other features. And it's really got to enhance everything that's on your face, especially for a woman or feminine presenting person. You want it to just fade into the background.
Yep.
But is it perfectly straight? Yours is pretty good, but
yeah. If we get nitpicky, I can nitpick anything.
Straightness is relative though, right?
Yeah.
Straight to your lips, to your chin, to your forehead. What are we talking about? So there's no perfect nose. If you're really talking about structurally improving the shape of a nose, it's surgery. I'm not just biased because I'm a surgeon. I'm a little biased, but it is surgery.
This is a viewer question, but I also wondered this too because this happened to me.
Okay.
Is it true you get leaky nose afterwards, and can you prevent that?
That's a good question. So obviously immediately after your rhinoplasty, everything's a mess in there. You're going to have swelling, bruising. A small percentage of people though will develop this leaky nose, and mostly it's patients that have allergies. So if you have allergies before, it's not going to fix your allergies, right? You got to treat the allergies.
Yeah.
And that's just because the mucosa, the lining on the inside is inflamed, and it's inflamed from pollen. It's inflamed from lots of other things.
Right.
It's going to continue to be inflamed, and it might be even a little more sensitive after rhinoplasty. So for the vast majority of people, it's not usually an issue, but for someone like you, it might have been.
This question is, can a revision be done with a lot of scar tissue from previous surgeries? So I assume this person's had multiple nose jobs.
Yeah.
And so she's probably afraid, or she or he is afraid that they can't get surgery done. Or I suspect maybe have been told that they can't do it anymore.
It's a sad one. But anytime you open up the nose, there's scar tissue. Like, you're basically opening up a plane of tissue that's never been opened before.
Yeah.
And now when you fillet this thing open.
Fillet sounds so bad.
Graphic detail.
Yeah.
You're going to get scar tissue. So yes, we're used to opening it and sort of like working through scar tissue.
Yeah.
But every time you do it, you develop more scar tissue. There's no way around it. We can minimize scar tissue after the procedure with steroid injections, with massage, but you're going to get scar tissue, unfortunately.
multiple surgeries, scar tissue, it could mess up the results of your rhinoplasty.
You just have to be okay with the fact that every subsequent surgery you have, there will be more scar tissue, more risk of complication, probably more steroid injections in your future, and more of a chance that you might not be happy with the final result. That's the big thing.
I mean, this is like the Michael Jackson effect, right? Like he ended up with such a small nose at some point. Absolutely. I remember it was like collapsing.
Oh yeah, there's only so much you can do, right? At one point, you're operating in a field that's like wet toilet paper. You're like trying to like suture things together that were sutured before and are just falling apart.
Yeah.
So yeah, it's scar tissue, but it's okay.
Yeah.
It's okay. Gotta go to an expert.
Noted. Okay. Do you recommend multiple consultations with different surgeons?
I think it doesn't hurt, right? I mean, you are going to spend some money, you're going to spend some time, but maybe you're going to find the surgeon that's right for you. It might not be the person with the biggest social media presence. It might not be the person with thousands of befores and afters, but it's the person that you trust that's going to take care of you.
Right.
That's going to be there for you after surgery, not just pawn you off to someone else to take care of you. And so you have to really appreciate that aspect of it. It's not just the surgery part, although that's a big one. And you should be doctor shopping, not just price shopping. That's one of my employees said that, which I think is perfect, right?
Yeah.
Price is important, but you also need to get a feel for who that doctor is.
Well, you know what I've realized is the more doctors I talk to, I'm in the position where I speak to a lot of doctors, but if I were a consumer or a patient, I would be thinking about it in the sense that I also learn about different techniques. And so I might have gone to one doctor and he told me how he was going to do something. And then I see another doctor. I saw this a lot with breast implants. So a little different from a rhinoplasty, obviously. But I noticed that so many doctors have different techniques. Like some like to go under the nipple, some like to go under the boob, some like to go through the belly button. And they have all their different reasons why.
Yes, for
and then you decide what works better for you.
Exactly. And that you want to make sure that that doctor's comfortable with that technique. I mean, I've been asked many times to do a closed rhinoplasty and I was trained to do them. I just don't do them very much. Yeah. So it's not a technique that I'm going to do.
Wait, tell us why, because that's actually one of the questions. And I also hear this. All the time. People will say, I want a nose job, but I don't want them to open the nose.
I mean, here's the thing. One thing is you don't want to dictate the technique per se, right? Okay. Your surgeon is trained to do something a particular way, focus on the result, focus on the care. And also you have to consider your downtime, right? Opening noses can increase the downtime a bit.
Okay.
However, if you want access to the tip of the nose, opening up the nose gives you the best access. Otherwise, you're operating through a small little tiny window. And there are surgeons that do a phenomenal job doing these closed.
Right.
However, I think patients should just not be focused on it. I don't think it really matters.
Well, so what I say is I also was caught up on that, which led to me not doing like my nose job and not having the nose I wanted because I was so caught up on not wanting to have my nose opened up. And so like for years, caught up on
what
I
was
don't
it
want
that
to
scared
open.
you?
Well, I have seen some people have like a divot where that scar is.
Yeah.
But I found the right doctor and nobody sees my scar.
No. If it's the scar that people worry about, it's such a vascular area. I've never had to laser one of those scars. They heal super well.
All right, looking at these questions, there's a lot around healing and the swelling process and all of it.
Yeah.
So let's get into the nitty gritty and really tell people what they should expect.
Don't expect your final result for a year.
Honestly, for me, a year and a half.
Oh, at least.
Yeah.
And I know surgeons that won't operate on people unless it's been 2-3 years since their first rhinoplasty. Even in Beverly Hills, like they will not.
Because you don't know what the nose is yet.
Exactly. The nose is just a dependent area. It just swells so much. Yeah. You'll like it one day, you'll hate it another day.
You know what? I still see it swelling. So sometimes I'm like, my nose looks bigger today. Is that so? Am I not making that up?
No, it happens. It definitely happens. And if you've had your nose done once before, then it takes even longer to heal. So you'll see. I mean, you'll see a big change in the first couple of months. Like it'll be like a.
Well, when the cast comes off, you're like,
looks great,
amazing.
Yeah.
Yeah.
And then 6 hours later, it's a giant sausage in the middle of your head, right?
Yeah.
But it's a better shaped sausage than you had
on your face. That's actually a good way of saying it.
But it takes a long time.
Yeah.
It's not to say that all of a sudden on day 366, your nose is going to look like you want it to. It's a slow progression.
Yep.
So I tell people usually presentable at about maybe 6 weeks.
I feel like by the 10-month mark, I start to really get a good idea. But it was truly at the 1.5 year mark that I saw exactly like how small. It was really the tip of my nose.
Yes.
Is that normal?
That's normal. So it'll start at the top. Everything will be swollen and be giant. Yep. And then everything will sort of collect at the bottom because there's really not a lot of place for it to go. And then that will stay there for months and months and months. And honestly, I tell patients a year, it really is longer than a year for some people. I've had some patients that look great at 6 months, and between 6 months and a year, can't tell a huge difference.
Right.
But a lot of patients, that 6 month to 12 month mark is huge, a huge difference.
So does it also depend on what's being done to your nose?
It depends on how thick your skin is. So if you have really thick skin, it's going to take you longer. If your nose is done open, it will give you more downtime. That's just what it is. There's more swelling, more tissues, planes are opened up. And then genetics, lots of other things. Salt diet, potentially also.
Oh, okay.
Yeah.
All right. We got a good question. And actually, it's been asked more than once. Do tip surgeries require major surgery? Somebody else called it a mini nose job, where they just correct the nose tip.
Mini anything is a scam. Let me just tell you.
Okay.
It's a total scam. It just means it's less work for your surgeon. But imagine like you want to go up 3 flights of stairs. You could build an elevator to take yourself all the way to the top, or you could just take the stairs, which are already there, right?
Yeah.
So you're making it a lot harder for the surgeon and for your recovery and for your result if you nitpick small things, because the nose is a domino. It's a stack of dominoes. You change one thing, everything downstream changes. You go to open the nose to take the hump down. If you don't close it up properly, the tip's gonna fall. And I've seen that with other patients before that had these mini nose jobs. So just get the whole thing done. It's not going to change anything.
It makes sense.
Yeah, you want the nose that's going to fit your face. And these are good questions because patients don't know.
Yeah.
But at the end of the day, you want the best looking result, and that is in the hands of your surgeon.
Will a rhinoplasty change my smile somehow?
It shouldn't change your smile. I mean, it should flow with the rest of your face. In the beginning, though, your nose is going to be tight. So remember, sutures around the nose to narrow your nose can make it change your smile a bit. Things are going to just feel a little tight. You're going to have some scar tissue. So all these things can make it feel that way. And the swelling can too, but it shouldn't change your smile. Except you have one little muscle right underneath here. We do cut that muscle so that the nose doesn't tip down when you smile.
Okay.
So that will change the entire dynamic of your face. So when you smile, your nose won't tip down. But is it going to change like the position of your lips or how your smile is? No.
This next question kind of goes back to the one about the scar tissue, multiple surgeries. Can you have more than one nose job? And also, by the way, what are the chances you need a revision anyway?
Okay, the goal is to do this once, right? You don't want to keep doing this, right? I mean, you want to just be one and done. This is not like breast implants where you have to replace them.
Yeah.
However, the revision rate in the US is about 7 to 10%.
That seems low, but it's high.
Very high. It's probably the highest for all cosmetic procedures for whatever reason.
Okay.
Either that you can't breathe after surgery, you're unhappy with it, you got hit in the face, we don't really know.
Yeah.
But it's pretty high. And it has been that way for years and years and years. And so you can bet that there's probably a 7 to 10% chance that you might have to do your nose again. Now, all the surgeons that you meet will tell you that the revision rate is much lower than 7 to 10% because maybe their patients are happy or their patients are going somewhere else. So.
Right. I want to bet they're going somewhere else because they sort of blame the doctor, whether it's his fault or not.
Right.
All right. This question I think is very specific to where you live and where you're going for your surgery, but somebody's asking about the typical cost of a rhinoplasty. I'll throw out there in Beverly Hills. I hear it's about anywhere between $13,000 to $20,000.
You'd be surprised.
Yeah?
Yeah. I mean, there are surgeons I've seen surgeons go as low as 10.
Yep.
I've seen 50, 70.
What? Wait, why? Why would it even cost $70,000?
I'll tell you, not revisions, including just primary surgeries.
Yeah.
A surgeon theoretically can charge whatever they want.
Right.
If they are like, I want to operate on celebrities and I want to do 5 surgeries a year, I'm going to charge whatever I want. Is it ethical? We don't have to touch on that.
Yeah.
But they technically can charge whatever they want. You're right. It depends on where you live. Do they have their own surgery center? How often are they doing this? How many do they want to do?
Right.
But it's cosmetic. So unless it's a functional issue, they can put whatever price tag. I've seen surgeons charge $50,000, $60,000, $70,000 because they can and they want to. And they patients are going to go to who they see as providing the most value, right? If the surgeon provides more value than what the patient's paying, then the patient's going to go there. There are people that charge $300,000 for a facelift. It is that is what it is. And they operate on celebrities.
Another question is a Botox nose job, which I've seen on social media, but this seems bogus to me.
It's a little bogus. Yeah. I mean, if your nose tips down when you smile, you can inject this little muscle right here so that when you smile, it's not as prevalent. But it's not changing the shape of your nose.
And it's only going to last like 3 months.
If that, because it's such a small amount. So I don't think it's worth it. If you want your nose done, you want your nose done.
And that's also, isn't that a dangerous area to be injecting anything?
Not for Botox. Botox is safe.
Okay.
But it's not going to help very much, sadly.
All right. Last question. Can you have a nose job under local anesthesia? Which, by the way, I'm going to throw out there. I asked to be knocked out. Even when I got my wisdom teeth, they were like, we could just do this. No, knock me out. Yeah, I do not want to know what's going on.
In my training, I had seen a rhinoplasty done under local, and that's what talked me out of it. I would never put a patient through that. Because there's blood dripping down the back of your throat. There's bones being broken.
Because it's not like you can't feel anything.
Oh, yeah.
It just doesn't hurt as bad.
Exactly. And there's stuff flying everywhere. So it's better to just go to sleep, get a nice rest.
You know what I think about? The hammering sound. When we would film in the operating room, we would hear like...
Yeah.
Can you imagine that? Like, even if you're under local anesthesia, you might hear it.
You're hearing that.
You're feeling pressure.
Yes, 100%. It's better for you and your surgeon that you're the most comfortable.
Yeah, because you don't want your surgeon being like,
exactly.
You okay?
No. I don't want them participating. I don't want participation in my surgery.
That makes sense.
Yeah.
That's too nerve-wracking.
Oh, yeah.
Well, thank you so much. This was really, really informative. I feel like I learned a lot even after my nose job.
Nice.
Maybe things I should have asked. But where can people find you? Because I'm sure they're going to have more questions in the comments.
Yeah,
so.
my social is Dr. Prem Tripathi on Instagram and TikTok. On my website is bayhillsmd.com. Send me a message.
Are we going to do YouTube anytime soon?
Oh, yes, I have one. The Face Duo. So at the Face Duo.
The Face Duo.
It's a new one. I'm not as YouTube.
Wait, why is it called the Face Duo?
It's me and another facial plastic surgeon.
Oh, so the duo.
Yes, he's in Newport Beach. So we got California covered.
I love it.
Yeah.
All right. Well, thank you so much.
Thank you for having me.
Talk to you guys soon.